You and Your Young Child, a program of information and services available for you and your child from prenatal to age 5. You and Your Young Child has been brought to you in part by the Straub Museum of Natural History.
Stop! Where are we going?
The Straub!
Don't get left behind. We're waiting for you here at the Sternberg Museum, where there's always new opportunities for
Discovery under the dome.
Hello, and welcome to You and Your Young Child, the program devoted to early childhood. My name is Dana Stanton, and I'm coordinator of early childhood grants for USD 489. And with me today is Margo Straub. Good morning, Margo.
Good morning, Dana.
Now, first of all, tell us where do you work and what do you do there?
I work at the Pediatric Center at Hayes Medical Center. I'm a physician assistant there and help with getting children healthy.
Good. Now, this is a time of year where everybody's got the sniffles, and there's a lot of controversy about, is it a cold or is it the flu? What is the difference between those?
A common cold is what most people get during this time of year, and little ones oftentimes will get colds 8 to 10 times in a season, no more than get over one and get another one again. Of course, a cold can have some lower grade temperatures and the runny nose, the cough, and maybe lead to some ear infections or something like that. But the influenza itself is like a cold on steroids. It has a super mucus and a really bad cold that oftentimes gets into the chest as well. With that, you oftentimes have headaches and body aches and higher temperatures.
Now, you talk about the flu and it's a little worse. What are some of the complications that can happen from the flu?
Particularly in young children under 12 have higher risk of getting complications with influenza such as pneumonia and dehydration, and they can lead to hospitalizations. Children with any underlying conditions like asthma or any neurodevelopment conditions, lung problems or heart problems are at higher risk for having complications of their chronic illnesses as well, and could be hospitalized for that.
I know as a mom, I sometimes sit and I think, my little one, they're coughing, they've got a runny nose. What is the rule? What are some guidelines on when do I keep my child home from school? When are they okay to go and when should they stay home?
Right. Like I said, most kids have the sniffles at this time of year, and you could probably walk into any classroom and see a number of kids rubbing their nose. The guidelines are that a fever is 100.4 or higher. I will tell you that the school will send your children home a little bit sooner than that, but they're not going to do random checks on temperatures on kids. So basically it's when they have even a lower grade temperature and other symptoms, such as a headache or a really bad cold that's keeping them or cough that's keeping them from being active in the classroom.
Now, what are some ways that we can give parents some ideas on how do you prevent colds or the flu?
With colds, I think a healthy diet is very important. It helps the integrity of the cells with many vitamins and minerals to try and help keep the virus from being able to attack it. I'm a big vitamin C promoter for that reason. Lots of hand washing or alcohol if you're not able to get to a sink with soap and water before eating especially. Try not to touch your face, your eyes, your mouth. Those are vectors of getting things in. For the influenza itself, of course, those things are important as well, but there's also a vaccine available.
Which kind of leads me to the next question. How soon can children have the flu vaccine? There's no vaccine for the cold, right?
Correct.
But for the flu, how early can they get that vaccine?
You have to be 6 months of age to get the vaccine. So children under 6 months, of course, are more at risk for developing it because they can't get the vaccine. For that reason, we want to make sure that everybody at home gets the vaccine to try and keep from bringing the flu home. If you're 6 months to 2 years, you're available for a shot only. If you're over 2 years old, then you can get a mist as long as you don't have any chronic wheezing problems.
I guess the final question is, when is it time to call you? When is it time to go to the doctor?
If you're having cold symptoms that are causing you to have some shortness of air or troubles catching your breath, having that higher temperature, typically we would like to find out if it is flu, to where we may be able to protect other people in the home and keep you out of school from sending it on to anybody else.
Yes, awesome. Thank you so much for being with us here today. Remember all those tips now that it's cold and flu season. You've been watching You and Your Young Child, the program devoted to early childhood. Parents, remember, you are your child's first and best teacher. Thank you.
You and Your Young Child, a program of information and services available for you and your child from prenatal to age 5. You and Your Young Child has been brought to you in part by the Sternberg Museum of Natural History.